Well, my educational background is I have a Bachelor's of Science degree in biology and I have a Master's of Science degree in biology. You know, going through medical school, you kind of ask yourself, what is it that makes you happy? And the time that I went to medical school, I had two kids. And that's what made me happy, was spending time with my kids. So with ophthalmology, I got a chance to do surgery, be in the clinic, and still spend a lot of time with my kids. Well, a retina specialist is a board certified, for the most part, ophthalmologist who has decided to subspecialize in just areas of the vitreous and retina. And there are medical retina specialists and surgical retina specialists. Most surgical retina specialists have completed either a 1 or a 2-year fellowship that is primarily just retina surgery and retinal diseases. You know, the patients that come to me in the retina practice are usually the patients that are either going blind or about to be blind. They're very scared, and I think that the technology has advanced so much in retina now that we're actually helping people. You know, the last 10 years we've been able to actually improve vision to many of these patients that come in with diseases. You know, 10 years ago they wouldn't see anything. And it's nice that you can prolong people's working lives. You can prolong their visual experiences by doing retina now. Well, I think the most exciting advances, and by far, would be the advent of the anti-VEGF intravitreal agents that we use now. We do intravitreal or injections that go in the eyeball for these patients that come in with wet macular degeneration, and we use the same injections, same drugs for patients with diabetic macular edema and retinal vein occlusions. And it really has changed the ball game. The statistics for these shots versus the conventional laser treatments, there's a huge difference. You know, with what used to be a treatment with laser, you would try to help people slow down their visual loss, you know, and it only worked about half of the time. And now with these intravitreal injections, I mean, you've got a 90% stabilization rate in these patients. So you can keep them where they are 90% of the time, and you can improve their vision 60% of the time. It's a completely new ball game.